Hello and welcome to our channel. Today we're addressing a critical public health issue, the resurgence of tuberculosis, or TB, worldwide. Despite being preventable and treatable, TB has seen a concerning increase in cases and remains a leading cause of infectious disease deaths. Tuberculosis is an infectious disease caused by the bacterium Mycobacterium tuberculosis. It primarily affects the lungs but can impact other parts of the body. The disease spreads through airborne particles when an infected person coughs or sneezes. Common symptoms include a persistent cough, chest pain, and coughing up blood. If left untreated, TB can be fatal. According to the World Health Organization's Global Tuberculosis Report 2024, approximately 8.2 million people were newly diagnosed with TB in 2023, the highest number recorded since WHO began global TB monitoring in 1995. This represents a notable increase from 7.5 million reported in 2022, placing TB again as the leading infectious disease killer in 2023, surpassing COVID-19. The number of TB deaths decreased slightly from 1.32 million in 2022 to 1.25 million in 2023. However, the total number of people falling ill with TB rose to an estimated 10.8 million in 2023. The disease disproportionately affects people in 30 high-burden countries, with India, Indonesia, China, the Philippines, and Pakistan together accounting for 56% of the global TB burden. Several factors have contributed to the resurgence of TB cases. COVID-19 pandemic. The pandemic disrupted healthcare services worldwide, leading to delays in TB diagnosis and treatment. This disruption has resulted in increased transmission and a rise in cases. Persistent underfunding for TB programs has hindered effective prevention, diagnosis, and treatment efforts. The WHO report highlights mixed progress in the global fight against TB, with significant challenges such as underfunding. The emergence of multi-drug-resistant TB mouth-provoking poses a significant challenge to treatment. In 2021, the burden of drug-resistant TB increased by 3% between 2020 and 2021, with 450,000 new cases of rifampicin TB. Southeast Asia. This region accounted for 45% of new TB cases in 2023, with India alone representing 26% of the global burden. Africa. The African region saw 24% of new TB cases. Notably, the number of people newly diagnosed with TB in the African region increased throughout the pandemic and continued in its aftermath, with a 34% increase above the 2019 level in 2023. Western Pacific. This region reported 17% of new TB cases, with countries like China and the Philippines significantly contributing to the numbers. Addressing the TB resurgence requires a multifaceted approach. Strengthening healthcare systems, enhancing TB diagnostic and treatment services, especially in high-burden areas, is crucial. Funding and resources. Increased investment in TB programs can facilitate research, improve diagnostics, and ensure the availability of effective treatments. Public awareness. Educating communities about TB prevention, symptoms, and the importance of completing treatment can reduce transmission rates. Policy reforms. Implementing policies that address social determinants, such as improving living conditions and reducing overcrowding in prisons, can mitigate TB spread. Conclusion. Tuberculosis remains a formidable global health challenge. However, with concerted efforts from governments, healthcare providers, and communities, it is possible to curb the rise in cases and move towards the ultimate goal of eliminating TB. Staying informed and proactive is essential in this fight. References. World Health Organization 2024 Global Tuberculosis Report 2024, retrieved from World Health Organization 2022. Tuberculosis deaths and disease increased during the COVID-19 pandemic. The Guardian 2024 Latin America's rise in tuberculosis linked to imprisonment rates. Thank you for watching. If you found this information valuable, please like, share, and subscribe to our channel for more updates on global health issues. Together, we can make a difference.